We're broadcasting from the Middle Tennessee Electric Studios.
MTE.com.
This is a WGNS Action.
Since 1947.
This is a WGNS Action Line. Now your host, Scott Walker.
Joining us in studio, we have Daphne David, the president and CEO of Ascension St. Thomas Rutherford, and also Dr. Brady Allen, who's in emergency medicine. Starting off with you, Dr. Allen, what made you want to go that route in medicine?
Oh, thanks, man. It's great to be here. You know, I loved all medicine, but I like the acuity of emergency medicine. You know, we get to see patients with all conditions, all complaints. We never know what our day is going to look like, and I just like the pace and the diversity of patient population and illness that emergency medicine brings.
Daphne, I know I asked you before, but you kind of started going the direction, that medical route, years ago in high school or college?
It was actually after college for me. I had a life event that led me in that direction. My mother, and we don't want to start too heavy this morning, but my mother had passed away, and through her illness, I had the opportunity to truly see what healthcare behind the scenes was like, and had the opportunity to experience someone touching your hand or praying for you or being there for families and for patients, and I knew that I needed to be a part of that. So her journey of illness took me into the direction, and God opened the doors for me to eventually become a CEO. That was not what I had originally planned to do.
It seems like I've talked to a lot of those who are in the medical field, a lot of first responders. They went into their field of work because of something that happened in their life at some point, often when they were a child.
I realized that this was an opportunity for me, maybe not to be a clinician, but to remove barriers and to provide resources for those who are taking care of the patients at the bedside.
And this morning we'll be talking about emergency medicine, reasons to visit the emergency room, things that happen over the summer. And for those listening, feel free to text in any questions you may have to 615-893-1450. And Dr. Allen, what are some of the most common things you see in the emergency room this time of year?
Yeah, we see lots of things. I mean, obviously, it's the summer season. Everybody is out and about. So we see injuries, whether those are car accidents, bike accidents, people out and about enjoying life. And then the typical things that we see no matter the season. We see stroke complaints, chest pain, abdominal pain, probably the biggest categories that we see.
And as far as heart attacks, strokes, things along those lines, I know there's a lot of different symptoms for those. And some of those symptoms could be because of something totally unrelated. But what are some of the symptoms people should look for?
For sure. You know, I think it's always a good time to review stroke type symptoms. You know, one of the things that we said about is mnemonic, so you can remember in the field. I think it's important to remember that if you have to think 2 times about whether this is an emergency, probably come and get checked out. But maybe you've got that family member that you're concerned about a stroke and you're trying to convince them to go. So there's the Be Fast mnemonic that you may have heard about. It's a really good way to screen someone for stroke, and most people can do it. And it talks about 5 things. B is balance. So are they falling all over themselves? Can they walk in a straight line? I is eyes. Is their vision suddenly, are they having problems seeing? Can they not look either way? That's something to watch for. Face. Is their face asymmetric? Is it drooping on one side? That could be a sign of a stroke. Arm weakness. Suddenly their right or left arm won't do what they want it to do. They can't hold things. They can't pick it up. We think about those things. And then speech. If they can't get their words out, if they can only get a few words out, if they're stuttering. And then the T of that Be Fast mnemonic means it's time to call 911. And so that can be an important thing for stroke.
Now, whenever somebody goes to the ER, I know they're always worried, well, am I going to have to wait this long? Am I going to have to, how long is it going to take to see a doctor? But there's some illnesses, some problems that people have that you're going to notice right away, or the person working in the hospital will notice right away. They need to be taken back immediately. And you have people who are trained to look for those things, I guess.
Correct. We have a very well-trained staff and coordinated emergency care where even from the first person that you see in triage, they are trained to identify medical emergencies and move those patients back. Here at Ascension St. Thomas, we really pride ourselves in the how rapidly we see all patients, but certainly we try to expedite care for patients that are presenting with true emergencies. And our triage staff is trained to identify those things. They get us involved in that care early as physicians, so we can provide exceptional care.
And Daphne, you were saying before we went on the air, the number of patients seen at not only the West Lawn location, but the original Medical Center Parkway location of the ER. How many patients a year again was it?
So we just finished our fiscal year of 2026, and we saw just under 99,000 patients at both of those locations. So at the West Lawn campus alone, it was about 16,000, and then the remainder of the patients were at the main hospital. And if we look at that total number, about 12,000 patients were pediatric.
Wow.
And thankfully, most of the pediatric patients don't require admission, and so we're able to treat most of those patients and get them back home timely. I would also add, as we're looking at how quickly we can get patients seen, of course, based on their diagnosis, but we're working continually to improve processes and to ensure that our patients have the lowest possible wait time when they come into the facility. So we can tell you from the moment the patient walks in the door to the time that they're triaged, to the time that they're seen by the physician, to the time that their first test is ordered, and that test is complete, all the way to the time they're either discharged home or they're up in a bed. And we spend hours every day working to get patients in more timely.
I remember having younger kids, and as parents, we often put our kids way before us, and we'll take the kids to the emergency room way before we ever decide we need to go to the hospital. Sometimes we probably should go and we don't go, but for parents out there listening, what are some good tips or ideas on things to look for when deciding if your child needs to go to the emergency room versus maybe an urgent care clinic?
It's always hard, every patient and every child is individual, and based on their past medical history, certain symptoms may be more important for them. But certainly I would say that high fever with a child not acting correctly, not responding to Tylenol or Motrin, I would say a pediatric injury, a fall and a head injury probably needs evaluation. Sometimes that's just reassurance by a provider that looks at that child and makes sure there's no signs of dangerous mechanism or problems with a head injury. I would say other things we talked about, bicycle accidents and those things. Parents can largely figure, is it a scrape or something, or is there something more sinister going on? Again, I would return to the layperson's kind of standard. If you have to think 3 times about whether this is an emergency, just have us check them out. I have 4 kids. They're our most precious things that we have, and so we want to make sure that they're happy and healthy.
Definitely. And head injuries, I'm guessing those are pretty big among children. I know my kids were always doing something goofy that got them in trouble to where they would have a head injury from time to time, from bike crashes to you name it.
Absolutely. We see a lot of those. And what I would encourage parents to do is we have very well-defined algorithms for how we take care of pediatric head injuries at Ascension St. Thomas. And we use all the most recent updates in those protocols. And so many times we can look at your child, apply those evidence-based decision tools and guidelines, and we don't have to image your child. But if we need to, we will. And our whole goal, obviously, is to make sure that they are safe and healthy.
We were talking off the air about electric bikes these days, and man, some of those electric bikes are just crazy fast. I've seen them in different neighborhoods. I've even seen kids riding down the main road on some of these electric bikes going the same speed as cars. It's wild how fast they are, but with that speed also comes danger.
Absolutely. It's a new category of injury that I'm starting to see. And as we talked, it's a little bit of unk energy. I'm older. I remember mopeds growing up.
Yeah.
And your mopeds weren't quite a motorcycle, but they would go 20 to 35 miles an hour. Most of the time I spent as a child tooling around on a bike was probably 5 to 10 miles an hour. Sure, we all had that big hill in our neighborhood that we went bombing down, hopefully with a helmet on. But most of our time was spent at lower speeds. What you see with these e-bikes, many of which are capable of speeds of 20 to 30 miles an hour, is just the time spent at a higher speed is larger. If you spend more time at that higher speed, the chances that an accident is going to occur goes up. And, I will tell you as an emergency physician, any kind of accident, whether it's a motorcycle, bike, or whatever, that you have at 20 to 30 miles an hour, especially if you're not wearing a helmet, is a serious injury. So I just encourage parents, as we see more of these, just to recognize the speeds associated with e-bikes. I think sometimes there's that feeling of security that it's a, quote, bike, but it's really not. It's a low-speed motorcycle, and just making sure that really young kids shouldn't be on them. And if it's an older kid, making sure they're appropriately helmeted and supervised, I think is super important.
And do you see, still today, do you see a lot of kids come in with accidents, caused by a bike, be it electric bike or traditional bike, where they're not wearing a helmet? Is that still a big thing, or are more kids wearing a helmet today versus, when we were growing up?
We do. And, I have to get on my kids about wearing helmets. So, I'm not immune as an emergency physician. And so we still see, unhelmeted child accidents. I'm hopeful that around the e-bikes, people recognize that they're a little faster, and that's just a minimum requirement. But yeah, we still do see unhelmeted accidents.
If we could just wrap our kids in bubble wrap,
Yep.
It seems like they would be a little safer, but they'd still find a way to get hurt somehow.
Absolutely.
And again, you can text us any questions at 615-893-1450. We had one question here. This one is asking, what symptoms should always send someone directly to the emergency room rather than an urgent care clinic? And it's kind of vague. That's a tough one. I guess it depends on the injury itself and what's going on. And I know you mentioned high temperatures.
Sure. When I think about things that always require an ED evaluation, I think about the big organ system complaints, and I think about severity. So, I've been doing this 25 years, and it still is hard for me many times to figure out what types of chest pain is dangerous and what is not. So I think that's one category. Chest pain, I think, requires an ED evaluation or you to see a provider. There's just too many nuances and there's too many dangerous diagnoses wrapped up in that complaint. Severe abdominal pain, severe headache, any neurologic complaint, my arm or leg's not working right. We talked about the BFAST mnemonic, or any type of significant trauma. There's others, but those are some broad categories. I often talk to patients that come in with chest pain and we do all their testing and everything's negative. And you often hear, well, I shouldn't have come in, everything was negative. And what I always say to them is chest pain is such a tough complaint for me and for all emergency medicine providers that it really requires the expertise of a medical provider to rule out the dangerous things. And so you shouldn't decide whether you should have come based on the result. It's more based on the complaint. And it's great that everything was negative, but you still required an emergency evaluation. And again, I think those things are in those broad categories.
Daphne, it seems like every time you're on, I bring up something that occurred during the COVID era, but we really did see an increase in a lot of different things during COVID, one of which anxiety and anxiety attacks, panic attacks. And is there a way for a patient to really tell the difference between a panic attack versus, let's say, the symptoms of a heart attack?
I think it's hard. Where I'll use that is if you have a previous history of it, if you have a long history of anxiety, you've had recurrent panic attacks, you're under the care of a provider who's managing them and your symptoms are similar. I think sometimes you can use that to say this. I'd say first-time panic attacks, that's something we want to see you for. Because as you point out, many other serious conditions can masquerade as a panic attack, whether it's a pulmonary issue, chest pain, or a cardiac event, or other things. So the guideline I would say is if you're under the care of a provider who's managing this, it's a familiar symptom, it's the same that it's been, maybe there's some discretion there. If it's a first-time anxiety or panic attack, that probably requires an evaluation.
And I know stress, a lack of sleep, that's something else that we always talk about, and how important kind of managing that stress and getting better sleep. Those two things are pretty important.
Absolutely. As an emergency physician, I work overnight, and as I've gotten older, the importance of sleep and rest is even more apparent to me. So I think those things are important when we think about, the basic needs triangle. Food, sleep, and shelter are kind of at the base. And you're not going to perform well in school, in your job, unless you have some of those baseline things taken care of.
And unfortunately, if you're under a lot of stress, sometimes that leads to a lack of sleep. So managing those things can be tough.
It is. I often tell patients there's no pill for life, and we all are under stress. And so it's how do you manage those things with healthy activities?
Yeah.
And that's different for everyone. I always am an advocate of exercise and getting out there and getting off your screen and death scrolling, as I talk to my kids about. So getting out there, physical exercise. But that can be other things too. What do you like to do? What decompresses you? Is it reading a book? Is it spending time with a family member? Find those things that fill your bucket and make sure that you're taking care of those needs.
So things like hobbies, actually having a hobby and doing that hobby, whatever it may be, that can be an important stress reliever, I guess.
100%. Yeah, I'm a fisherman, right? And so people say when I go fishing, what are you going to catch? And to my answer is, I don't really care.
Yeah.
I just want to get out there and get my mind involved in an activity where I'm so focused on it that it diminishes my stress in other areas of my life. And I think you can apply that to any sorts of hobbies that give you relief. So I think you make a good point.
Have you been, out and about somewhere where somebody had some type of an emergency episode where you had to jump in and roll your sleeves up?
Like on the movies.
Yeah,
yes,
like in the movies.
Is there a doctor on board?
I would say, fortunately and unfortunately, right? I like to not work when I'm away, but obviously I'm always there for the community or for patients if something happened. I've had several. I'll obviously do it in a HIPAA compliant manner, but I've had a febrile seizure on a soccer sideline where I attended to a young child having a seizure, and that child did great. I was actually with one of my colleagues, so they had 2 emergency physicians pretty quickly. Many traumatic injuries. My kids are in sports, so I've done several head injury evaluations on the sideline. And so, yes, as providers, I think most physicians, if they see someone in need, would step forward. That would be what I would hope would happen.
Fortunately, I've never been at a location where I saw like a kid having a seizure, but I've seen adults have seizures before. That's scary just to watch. Because you feel, I'm obviously not a doctor, so I feel kind of helpless in those situations, but that's scary.
I agree. And the good news is, that's a good time. We talked about things to call EMS for in 911. Yeah. Someone have a seizure in a public place is probably one of them. And so, hopefully you diminish a little bit of that anxiety. Call 911, call for help if you don't have medical training. That's the right thing to do, and don't feel like you have to intervene.
And there's not doctors always nearby to come and save the day.
There's not.
So
there's not.
It can be tough.
The one time I will say, so far I haven't been called on a plane, and I'm thankful for that. But every time I get on a plane, I'm a little anxious until we land that we're going to have a medical event.
Yeah, I guess if I were in the medical field, that would be the top of my mind. Am I going to be somewhere where something happens where I need to help somebody out? That you've got to always be thinking that almost.
You do, and of course, because of my profession, I know what medical supplies we have on the plane, how limited oxygen we have, because obviously it's an explosive risk and all those things. So I'm always thinking, what am I going to do with the limited supply I have to get these patients on the ground? And of course, being an emergency physician, having a pretty broad network, I've heard of stories of my colleagues that end up with very ill people on planes with limited medical supplies. So that's probably personally the one I worry about the most as I'm sitting on the plane, hopefully going somewhere fun that I might be called to work. But of course, I'm there if it happens.
The next time he's on, he's going to tell us a story which this occurred while he was flying on vacation.
I just jinxed myself for sure.
Well, what is over the years, what is by far one of the strangest things you've seen someone come into the ER for, or most bizarre set of circumstances?
Well, we got to keep it G-rated here. I would say that, there's so many things. I've had monkey bites.
Monkey bites.
Wow. That have been, in fact, that's probably a weird one that I've seen from South. You don't run across that
every day.
Yep, monkey bites. All sorts of bizarre injuries and stories. But yeah, I'd say a monkey bite.
Yeah.
It's not something you see every day.
Do we have monkeys here in the area? Very many?
The bite was not on this continent.
Oh, okay, good to know. Good to know.
Yeah, the next question would be if that's happened locally. I mean, I think there's laws against owning your own monkey unless you have some kind of special license.
I would hope so.
Who knows? So I guess locally, I mean, gosh, the number of reasons that people would go to an ER, it's a vast list of reasons, I'm sure.
Yes.
But I'm sure you also have some who come to the ER for something like as minor as a scrape, and you got to be asking yourself, why did you come to the ER for this?
I don't generally ask that of my patients. Once they've made the decision to come and get care, I don't see a lot of utility in questioning why they're there. They're here, they're in front of you, they have a concern. Many people come to the emergency department not only for medical emergencies, but out of fear. And so, I remember one recently that maybe illustrates this point, that someone came with a mild scrape, but they had a loved one develop a terrible limb-threatening infection. And so for them, it was a scary thing. And so we talked about it. We didn't have to do any testing. They felt reassured. So I think everyone brings their own experiences. I've always tell my providers, my docs, once they're in front of you, there's no reason to talk about why they were there. They're there for a reason. And, the good news is if it's relatively minor, we can triage, treat, and discharge or disposition them quickly in an efficient manner. And that often makes patients happy as well. So you're right. People come in for all the variety of things. But I will say when you look nationally at the data, people self-triage pretty well, and although you hear those stories of inappropriate ED visits, and some do occur, it's really not the vast majority of our visits. Most people self-triage pretty well.
Yeah, you bring up really good points. In fact, that I guess the general public doesn't think about, what happened to this person years ago? What did they see in their life? Was it their mom? Was it their dad that would often maybe panic over an injury, no matter how mild it was? But yeah, everybody, I guess, brings their own story behind that injury and why they're coming there.
Yeah, if you have a mild headache and it's not a big deal, but you have a mother that died of an aneurysm, that's going to be a really concerning symptom to you. And so I think we just we treat the whole patient. We recognize they're coming with their experiences and their medical history. And again, we don't want everyone just chat GPTing at home and the developing delayed presentations for bad things like strokes and chest pain. So use those resources. Use us when you feel like it's necessary.
One of the big questions that doctors, that nurses will ask a patient when they're in the ER, are you safe at home, or do you feel safe at home? How in the world do you go about asking that when you see the situation and you got a pretty good hunch, a pretty good feeling there's something more going on here, but you don't want to ask that right in front of a potential abuser who may have hurt that spouse, who may have hurt that child? How do you go about getting to those answers correctly?
It's a really good question. I would say I would point out that the data as a whole is that we don't do a perfect job of this in medicine. We miss a lot of those things, but we try. And what I would say is for anyone that's in distress or in one of those, we have ways in which if I'm suspicious that I can remove that person without them knowing. It may be that I order an x-ray, but you don't actually get an x-ray, and I meet you over in radiology. So as someone that's done this for 25 years, it's really never a problem for me to find time if I'm suspicious with a patient. I can use all sorts of techniques to get that patient alone in a safe environment. Again, when we identify those things, we try to provide them with resources. Now, you have to recognize that that's all we can do many times. And we want to always say that our ERs are safe places where you can get help, where you can find safety if you need be. And then we tailor that to what's right for the individual.
That's positive and reassuring to hear, because, that's every parent's worst nightmare is that their child grows up and if they marry the wrong person, if they date the wrong person, those are fears that we all have. And then, you also worry about, well, what if my mom starts dating again? Whatever the case is, those are fears that we all have about our loved ones.
Agree. And that's always something that's top of mind. In our emergency department, unfortunately, we see a lot of domestic violence, and it's something that we keep an eye out for, and we certainly offer those resources and counsel those patients in a way that protects them, and doesn't make things worse for them.
And we had another question here, and this one is asking, when does a high fever require emergency care, especially with an infant or a child, and also in older adults?
There's not one answer for that. That's a really tough one. What I would say is that if you have a child with a high fever that's not behaving normally, it's probably time to call your pediatrician or come see us. High fever, I wouldn't call it normal, but is a part of pediatric illness. Many times these are viral illnesses that will pass on their own. But the details around all-encompassing statements about when to come with fever or not are hard to make. The one I would say is if your child's not acting normally, if they're lethargic, they won't wake up, they have a rash all over their body that's new, they're short of breath, those kinds of things I would always come in for. The rest of it, I think it falls into that. If you ask 2 times, if something doesn't seem right, have us check out your child or at least call your pediatrician.
You bringing up that rash reminds me of allergic reactions. And
correct.
Man, that is another scary situation where, you can develop different allergies throughout your life, and then next thing you know, you're allergic to who knows what, and you break out in hives, and then you start to feel like you can't breathe, and your throat starts literally closing up. But there are so many allergies that people have today, and they develop over the years without realizing it. That's another scary situation.
It is, and we're fully equipped to take care of any allergic reaction. I think people that are aware that they have anaphylaxis or severe allergic reactions, I'd encourage them to just make sure you're carrying your EpiPen or your pediatric EpiPen and making sure you're having a couple of those in places that you might be, because that really can be life-saving treatment before you get to us. And then I think there's a lot of discernment in the emergency medicine space, especially in pediatric allergic reactions, on just being able to recognize them.
Yeah.
Rash is a common one. Hives, I think that we see shortness of breath. But in kids, sometimes it can be vomiting. It can be GI complaints as well. So if you have a child that has a rash all over and they're also vomiting, but maybe not short of breath, that's a kid we want to see. We talk about organ. That's more than just the skin. That's another organ system. So it can be tricky in pediatrics. Again, Ascension St. Thomas Rutherford, see a lot of kids. We're happy to check them out and make sure they're okay.
I know I've got allergies really bad, and I know I usually have an EpiPen close to me at some point, but my wife has had to use one on me before, and honestly, I couldn't even feel it whenever she injected it into my leg because I was more focused on the fact that I wasn't able to breathe like I normally could breathe.
That's right.
But those are scary situations for sure, so having more than one EpiPen nearby is definitely a lifesaver.
Yeah.
To address the question about the older adults as well. Yeah. So clearly I'm not the physician here, but just to bring up a point, if there is an elderly individual that has a fever and may have some confusion, that might be a reason to bring them in as well, correct?
Yeah, thank you, Daphne, for making sure I was circling back on that. Yeah, fever in the elderly, pretty much any sort, probably requires an evaluation. If you're 85 and you have 103 fever, Daphne points out confusion, shortness of breath. There's sepsis syndrome, which is when you get an overwhelming infection. It's very common as we get older. And so in those older individuals, yes, fever really requires an evaluation.
One of the things we've been hearing a lot about in the news lately, and it's a report from the CDC about those who eat, any type of vegetables or fruits, that are, I guess, contaminated with, what is it?
I think it's Cyclosporidium.
Okay.
Yep.
So now I understand it's also lettuce. I mean, there's just a lot of different things we could potentially eat that causes a lot of problems. But locally, are you seeing, these reactions from folks?
We have not. I certainly have not. I haven't heard of a frequent number of them. So they're out there. It's something to pay attention to. If you follow the news, you've noted that most health experts say that if you're healthy and immunocompetent, you don't have a risk factor, it's often a self-limiting illness requiring no significant treatment. We haven't seen a bunch. Daphne's probably more on, she probably might know if we've had other reportable cases. I haven't had it in my practice. I haven't heard of my colleagues, so we haven't seen a whole bunch of that.
And I guess properly washing fruits, vegetables before you prepare them is another really good way to avoid getting something.
Correct. All the typical things that we do, especially with raw vegetables.
And again, folks can text in any questions to 615-893-1450. Here's another one. What symptoms could indicate that a person is having a stroke, and could a stroke happen at any age?
Absolutely. We talked a little bit about the BFAST mnemonic to think about, but I think, again, it's always good to think about it again. Are there balance abnormalities? Is there vision change? Do you have arm weakness or facial asymmetry? Do you have speech difficulties? Those are some of the big ones. And for those, you want to call 911. Obviously, as you get older, and certain risk factors like being a smoker, high cholesterol, hypertension, diabetes put people at higher risk of stroke. And those are the populations older with those risk factors probably we see most common. But you can see strokes at any age. There's some congenital things you can be born with that can cause strokes early. So I wouldn't discount symptoms based on age. Even if you're a young person and you develop one of those symptoms that I just spoke about, you should come in and get evaluated.
Daphne, I'm curious. I know we have an ambulance service, obviously, in Rutherford County, but are they taking patients from things like car wrecks to both West Lawn and St. Thomas Rutherford, or are there certain injuries where they only take them to one hospital versus the other, one emergency room versus the other?
Our EMS partners are well-trained, and they can make a determination if they believe that patient might require admission. They will likely take them to the main hospital to avoid another step in that process.
So that makes sense. They can get them to the right place a lot quicker than, let's say, us driving there.
Yes.
It's a constant dialogue and communication with EMS, and so we have a great relationship here. So, for example, I've worked at West Lawn a lot. If we have a severe trauma that may require more resources, we'll often direct those to Rutherford. If it's a motor vehicle accident with one or two complaints and a stable patient, we'll bring them to West Lawn. We'll tailor that care to the patient, and we really make that individualized to each situation, each patient.
And of course, St. Thomas is about to open, or I guess start building, another standalone emergency room department.
We are. So it's off the corner of Las Casas Pike and East Pitts Lane, right next to the Murfreesboro Medical Clinic building that has just opened. We are very excited and plan to break ground in early 2027.
That's got to really help patients, especially in some of the more rural areas, as far as getting to care quick enough.
One of our main goals outside of providing excellent care and quality outcomes is to ensure that we are meeting patients closer to home. And we recognize that as rooftops go in, our community is growing so rapidly. Anytime that we can improve the amount of time that a patient is being seen and treated, and get them back to life quickly, that's what our goal is. We're working not just with that location, but other rural hospitals to provide additional support to keep their patients closer to home as well.
Over the years, I can only think of one time when we were on vacation, and it was when we were on the way home where we needed an emergency room, and we, followed the big blue hospital signs to whatever exit it was. But fortunately, that is the one and only time that's ever happened in my life. But when people are traveling, do you often see people who are coming off the interstate literally come to the hospital for emergency care because of something that happened while they were driving?
All the time.
All the time.
All the time. Yep.
Interesting.
Yep. It's a busy area, obviously. A lot of people want to be in Middle Tennessee or traveling here, even if they're not traveling through, they're visiting family and they're from out of state. So we see those. We see people just pull off the highway and come see us in the emergency department when needed. Obviously, we see people that are traveling through and getting accidents and are brought to us by EMS. So all manner of way, but yeah, we see, not only do we embrace taking care of our local community, but anyone that needs it.
And of course, it is a good thing to call 911 to be transported by ambulance to the hospital, especially if you have no clue where you are.
Absolutely.
Another question we had here is, why is it so important, well, speaking of 911, why is it so important to call 911 rather than to drive someone to the hospital when something like a stroke is suspected?
I would say that it's time and planning. We activate something called a stroke alert, which gets things ready for patient arrival. and even starts treatment by EMS. So what I would say is we want them in our ER as quickly as possible. If you're visiting someone in the hospital and you develop stroke symptoms, don't call 911, come down and see us, right? We want time is neurons, time is brain, get to us as quickly as possible. But if you're out there, you're an extended transit time, we want those EMS providers at your bedside calling us, getting everything ready as soon as possible. Again, I think it comes down to time, each individual scenario, which would be best to call 911 or bring the patient to the hospital. We depend on you being at the bedside or with your loved one, and how can you get us there as quickly as possible? The other thing is it might be something different. Maybe you think it's a stroke, but it's a cardiac issue. And could you have an adverse event or a problem in transit? I would always love if it's a serious condition, heart attack symptoms, stroke-like symptoms, call 911. And then you could also make an informed decision with the 911 operators there too, and talk about the best care for your loved one, friend, or patient.
Adding to that, and just to piggyback off of what he had said, is that you might be putting other individuals at risk if you're trying to drive yourself during a situation that could be life-threatening.
Definitely. Going back to something that you said earlier regarding, if they come in for a minor scrape and it ends up to be, really nothing, but they're able to ease their mind by coming into the ER, the ability that the doctors that I've seen here locally have in making somebody feel comfortable and welcome is huge. You're able to put people's minds at ease, and I've seen just the opposite of that out of town, where somebody comes to the ER and you can tell they feel uncomfortable from the start. But here locally, I have seen a difference where the doctors do make people feel at ease and welcome, to where by the time they leave the hospital, they're laughing and joking.
Well, I appreciate that, and we spend a lot of time and effort to make sure our patients feel that way. I won't make any derogatory comments on care elsewhere, but I will just comment that we care about our patients, and we train residents. We're in a semi-academic center, and one of the things I always talked with my residents about is you should obviously communicate well with any of your patients, but the less testing you do, the more time you need to spend.
Yeah.
And sometimes that's what patients need. They don't need a lot of tests. What they need is your butt in a chair, and to sit and chat with them about why they're concerned about what may be, as we've talked about, a minor complaint to a medical provider, but really is inspiring some fear. And y'all often use open-ended questions, patient, what scared you today? To try to get, because sometimes it's not the scrape, as you point, maybe it's domestic violence, maybe there's another reason that they're there. And so I appreciate you saying that. We really pride ourselves in the service that we provide to the community and our patients, and really try to be excellent in that area.
I guess part of that battle is when you have a new patient is getting them to calm down enough to really explain what may be going on, what may have happened, what caused this injury, and how it needs to be fixed.
Absolutely. I'll give an example. This happens to me frequently. I have, we talked about pediatric head injuries. You have a child that came in and fell, and I, from a lot of medical experience, will go through the decision rule and they don't need imaging. Well, they've spoken with a family member that said, you have to get a CT, they're going to have a brain bleed, and they've gotten everybody upset, which I understand. They just care and they don't want anything bad to happen. So you need people to calm down so you can make an informed medical decision for a child. And so oftentimes I will sit down there and I will pull the decision rule up on my phone. We have decision rules that have points of data, and I'll run through it with them. And to your point, you have to spend that time and to develop confidence in your decision-making rapport with the patient so they feel good about the medical decisions being made.
And as a parent, the last thing I would want is to scare my child,
Yes.
but yet you do see parents who panic, and I think that panic puts more fear into the child than anything else.
Maybe, but it's understandable. As a parent of 4 kids, the emotions that you have when my kids have been patients in healthcare, even with my training, it's a different experience. And obviously you care about them so deeply and you're worried about them so much. Sometimes it can kind of cloud your judgment and composure around those things. And that's understandable. That's human nature.
I didn't realize it's already 8:57. So we're pretty much out of time. But for those listening who, may next week, this week, tomorrow, whenever they may have some type of emergency pop up, it's good to get checked out, obviously, but making the decision to actually go to the hospital, I mean, that's step one right there.
Absolutely. And, if you think you need us, we're there, and we'll hopefully take great care of you. And then what I say to all my patients in a joking manner is, it was great meeting you. I'm so glad everything's okay, and I hope I never see you again, in a joking manner. But if you need us, we're there.
And for anybody who has more questions about the signs to look out for stroke, for heart attack, where's a good website to turn to that people can actually trust?
CDC has great evidence. You can go to the CDC's website, and they have got a lot of good information on many different medical conditions and things to watch out for.
Sounds good. Again, with us this morning, Daphne David, the Ascension St. Thomas Rutherford President and CEO, and also Dr. Brady Allen, who is in emergency medicine, obviously in the ER at St. Thomas Rutherford. Now, are you also at West Lawn as well? Do you kind of go back and forth?
I work there occasionally, yes.
Okay. Well, we appreciate y'all joining us this morning.
Thanks so much for having us. It's great to see you, Scott.
Thank you so much.
Talking with Rutherford County newsmakers about what matters most to you. This is a WGNS Action Line.
This is Bud Rakes, former principal of Smyrna High School. I'm a resident of Adams Place, and I recommend that you come and visit us here at Adams Place. It's a great place to be. The people that work here, all of them are very nice, and I never have met one that was not. And, of course, I would encourage anyone, if they're looking for a place, to look at Adams Place, because they'll have a hard time beating it.
Adams Place, on Memorial across from Walmart.
When news breaks, when traffic's horrendous, when the weather's bad. Be the first to get the news, traffic, and weather you want with a text alert from News Radio WGNS. Free text alert. Sign up online at WGNSradio.com. WGNS is powered by Middle Tennessee Electric. Since 1936, MTE has provided the reliable service and peace of mind we count on. Manage your account anytime at MTE.com or through the MyMTE app.
Hi, this is Dan with Music World and Drummer's Den. Our prices are as good or better than the box stores. I don't think you'll do better by shopping online than you would by coming in. Something new we've just added to our repertoire is drum repairs. You can have drums cut, covered, rewrapped, new hardware. We will fix them, make them look like new again. I'd like to thank you for coming by to see us again at 2762 South Church, right across from the golf course. Music World and Drummer's Den. Thank you very much for being our customers.
When I eat healthy, I can eat at Demas's. When I want to eat unhealthy, I can eat at Demas's. If I'm in the mood for pasta, I go to Demas's. If I want steak, I go there. It does not matter what I'm in the mood for. This is Peter Demas. The only thing we don't have is fried food. So it's very easy when you want to take a group out and there's that veto power person who's like, I don't want this. Well, we usually will have something that they want because we have such variety on our menu. The only thing we don't have is fried food. Demas's Restaurant on Northwest Broad Street.